Uh,
Hello there. Just gonna give it a minute to let people funnel in. Thank you for coming.
Danielle, help me out. Where is presentation mode on?
Up in the.
Why can I not find this?
It's either up in the left-hand corner or down in the bottom right corner.
Oh, okay, I see it down at the bottom now. Yeah, okay.
Okay, cool. Well, I'm gonna just get started. I'm going to be short and sweet tonight because I'm sure some people are sick of hearing me talk. We just had a program, a virtual mental health fair last night, which was pretty fun, but everyone's probably sick of me by now, like I said. I'm Danielle Angelari. I'm the executive director of NAMI Northern Illinois. And for those of you who aren't aware of our organization, we are an affiliate of the National Alliance on Mental Illness, and we serve Winnebago and Boone County. Actually, tonight is our last program for May, last but certainly not least. We will have another program starting June 1st, which will be on supported employment programs with Jason Holler from Goodwill. And then we'll have a couple of more in June for you, but I won't bog down your calendar just yet. And I do want to mention that our annual event is coming up on June 7th. So registration is coming to a close here soon. So if you'd like to golf or come to our after hours event, if you're not a golfer, we'd be happy to have you. It's always a really fun day, and we hope to see you there. But for tonight, I would like to introduce to you two representatives of the Winnebago County Community Mental Health Board, here to talk to you about what they've been doing for the past, I'm not sure how long, year? How long? Over a year?
yeah.
Close enough.
Yes, I'd like to introduce you to Jason and Dick. Not sure who wants to take the floor first, but I'll hand it over to you. And if anyone has questions at the end, I'd be happy to facilitate them with these two. If you want to put them in the Q&A box, please do. Thanks, guys, for coming.
Yeah, Dick, why don't you make an introduction for yourself, and then I'll start the show.
All right. So, hi, I'm Dick Kunnert, and I've been around Rockford and mental health for a long time. I was at Singer Mental Health Center. The last 11 years that I was there, I was superintendent. So in my retirement, I've been involved in a number of different parts of the mental health system with the Mental Health Association, and I've had membership on and off with continue with NAMI. During part of my retirement, I was on the state board of NAMI, so familiar with the organization and really appreciate what all the people do. It's excellent for the support that it's given. Right now, I'm on the Winnebago County Mental Health Board and an officer of that board. And we're involved right now with our first grant cycle. And the person who really knows all of this is Jason Holcomb, who is our administrator, who has done an absolutely fantastic job for the board. And I'm going to let him initiate a presentation that he's put together.
Thank you, Dick, and thank you, Danielle. My name Jason Holcomb. I'm the Community Health Coordinator at Region 1 Planning Council and serve as an administrator to the Mental Health Board, as Dick mentioned. Some familiarity with NAMI as well. I'm a longtime participant in the summer volleyball tournament. I don't think I've ever made it. I don't think I've ever won a game in the volleyball tournament yet, but this summer is going to be my year.
I'll hold you to it.
All right. All right. So I'm going to share my screen, recognizing now that I haven't done that yet. Okay. Look good? All right. So Dick is the vice president of the Mental Health Board, and here's a list of the other board members. And I won't go through the entire roster, but I'll just say that it's really been a pleasure working with a group of strong advocates for mental health, community leaders who have really been involved in community projects and initiatives for many years, and really just an all-star team of advocates. And all of the information we're presenting today is stuff that can also be found on the website, which I'll share at the end. So if I go through something a little quickly and you don't get a chance to catch it, please refer to the website, and you'll find all the information that you could possibly be looking for. So just to give you a little rundown, because Danielle was asking earlier, well, how long have we been doing this? And well, it has been over a year. In March of 2020, that was when the half-cent sales tax was approved by a voter referendum in the primary election. And in April was when the board appointments were finalized. I believe the two at-large board appointments, I think the remaining board appointments were actually done in March. So April was when essentially the board was finalized and began meeting. And so in May, there was an election of board officers and bylaws were adopted. And shortly thereafter, the board recognized the need for administrative support, and so contracted with Region 1 Planning Council so that we could offer assistance in that area. An environmental scan survey was developed, and that was pretty critical to the initial understanding of what gaps existed in the mental health system of care in Winnebago County. And I'll talk a little bit more about that as we get into the strategic plan part, but just kind of showing in the process, really it was almost a full year ago that we started really doing the research that has now led to the types of programs that will be funded. In July of 2020, a 3-month budget was developed, and the arrangement with Region 1 Planning Council was executed. We began our services, providing the administrative support in August. And that's when we put out the environmental scan survey. So if you're participating today as a representative from a mental health agency in Winnebago County, you might recall a survey that you probably felt was too long. It probably took 20 to 30 minutes to fill out, but that information was so critical to our understanding of what gaps existed in the current system and also what strengths were there to leverage. In September of 2020, developed an entire fiscal year work plan and fiscal year budget for the fiscal year 2021, which was the starting in October. And that was when also that budget being approved was when we were had the amount of the $8.8 million budgeted that we would be able to award in grants this funding cycle. Okay, there we go. So moving into October, beginning of a new fiscal year, we finalized vision, mission, values, and principles, which really became guiding and foundational to all the work that we would do moving forward. Putting that in place before we developed a strategic plan was really critical to have the proper foundation in place. And in November, those environmental scan results were analyzed, and we published those publicly for everyone to view. And then that was used as kind of the framework or a guiding document that then led to a public participation survey. The environmental scan survey really helped us understand the gaps. And then the public participation survey helped us prioritize which of those gaps were most important to fill immediately. The results from the public participation survey were quickly analyzed and published as part of a 3-year strategic plan in December. And then the notice of funding opportunity was drafted. And in January, the notice of funding opportunity was published and a grant application was open. And so the grant process, really critical to that, was the 3-year strategic plan, because this is a strategic giving process essentially mandated by the Community Mental Health Act of Illinois, which dictates that community mental health boards need to develop a strategic plan for the improvement and expansion of services in their municipality, and that should be the guiding framework that dictates how funding is directed. And one of the, even prior to the development of the strategic plan, the board had really decided and agreed upon using this community support system framework, which Dick can tell you dates back even further than the campaign for the half-cent sales tax itself. It's been really identified as a best practice by multiple mental health planning groups in this community over several years. And really the missing component of it was having the funding to fully implement it. You'll see as you look at the community support system framework, an array of services with coordination, connecting it on the outside layer, and case management being kind of the connecting component for the individual and families navigating all of these services. And the idea is that by having this type of array of services in your community, it allows for individuals with serious mental illness and significant substance use disorders to live and recover in their community. And while some of these things you might look at and say, yes, we already have that in our community, that very well might be true. In the environmental scan, we identified that there were gaps in each of these areas, and many of those gaps existed because the funding mechanisms that currently exist did not cover all of the types of services that are needed to fully complete this community support system model. And again, that really justified the need for a local mental health fund, as many other municipalities in Illinois have. And so this became critical not only to earlier planning efforts and the campaign itself for the half-cent sales tax, but then became the foundation for the mental health board's 3-year strategic plan. And in doing the environmental scan survey, each of these services were basically surveyed to the agencies providing services to help identify what services currently existed for each of these areas and also where there were gaps. Similarly, in the public participation survey, the community support system framework was used. And here you'll see for each of those kind of spokes of the wheel that you saw in the earlier slide, there's a further breakdown of the specific types of services that are components of each of those broader areas of focus. So for example, client identification and outreach, which you saw in the community support system framework. If you break that down, you'll see there's 3 critical components to that. There's the client identification, which really is finding clients who meet the criteria for mental health services and connecting them to services, outreach, which includes organizations who provide services going out into the community and making their services known, making people aware of their services, and then transportation assistance, which is the literal connection of people to services. And so for each of those, broader focus areas, you'll see a breakdown of specific services. And another thing, that you'll find on the website is a what's called a community support system primer, which has a very detailed breakdown of what each of these services are. And you can also find some more information about them in the Mental Health Board's 3-year strategic plan. But the point about the public participation survey was we knew there were gaps in each of these areas, but we had to prioritize them because while we have, a local mental health fund, even still, it may not be enough to cover every single component. We're talking about, 21, 22, 23 different services here. We needed to get an idea of the people who are utilizing these services, their families, providers, administrators, all of those folks who are connected to mental health, how they perceived what was a priority, what was most urgent to fix right now. And so you'll see the results of this survey in the light, in the dark green category. You'll see the ones that were most highly rated for any particular demographic group. So you see the breakdown in demographics of education, gender, perspective, as I mentioned, the lived experience versus provider perspective or community resident, and race and ethnicity. And then we kind of did a data analysis of each of these different demographic areas to find within each demographic what was ranked most highly and what was ranked as the lowest priority. And then also saw how did that kind of play out in aggregate. And so I've probably spent too much time breaking that down. If you want really to see a more detailed analysis of then how that led to some of the priorities for the strategic plan, I really encourage you to read some of the narrative around that in the strategic plan. But ultimately, that analysis led to the identification of priorities. And so 6 priorities overall were identified based on these rankings. And number 1, and kind of across the board, almost for every demographic group, was mental health treatment. Kind of the traditional components of mental health treatment: diagnostic evaluation, counseling, medication management, and substance abuse services. So, for any one of these priorities, you'll see the service areas, target populations that have been identified as being the those who have the most critical or serious functional deficits due to the mental health issues that they are experiencing, those that are having the hardest time living in the community because of the symptoms that they experience. That is the ultimate goal here, that those that are having the most difficult time have the most supports to wrap around them and help them be able to live and recover in the community. And so those target populations were identified as those who most critically need these services. And then there were some outcomes that were identified. So if these services were to be provided to these target populations, what's the expectation? What's the improvement as a community that we want to see? And so we recognized that there were certain outcomes that were going to be improvements for the agencies themselves, that the agencies, by hiring more staff and expanding services, would likely see more providers, decreased wait times, increased hours of service in some cases, more mobile services, increased translation. And then there's also going to be those individual and family level impacts that the recipients of services see, that they experience, right? That they're experiencing symptom improvement, that they have more connection and ability to be employed or to pursue education, or for children that they're seeing education and academic success as a result of their symptom improvement, that there's less criminal justice involvement, that there's more stability in housing, just to name a few of those. And then lastly, we believe, and maybe it's hard to prove causality, but at least believe that there is a contribution that if these outcomes were to happen for individuals and families in our community, that there would ultimately be some community level, population level improved outcomes, that we'd see a decrease in the suicide rate at a county level, that we'd see a decrease in the number of opioid deaths at a county level, that there'd be a decrease in incarcerations of individuals who have mental illness or substance use disorders, and also that there'd be decrease in homelessness for those populations. So priority 1, mental health treatment. Priority 2, case management. Priority 3, crisis response services. Priority 4, family and community support. Priority 5 and 6 are part of the 3-year strategic plan, but they're priorities that will not be eligible for funding until next year, because we did not have a full year of funding for this grant cycle. We had about 2/3 of a year of funding to distribute. So we are doing about 2/3 of those priorities, exactly 2/3 actually. The first 4 out of 6. Priority 5 and 6 will be eligible for funding next year, and that's client identification and outreach and housing. So just to give you kind of a brief overview or update for those of you that have already been engaged in the process, a little bit of the grant timeline. On January 13th is when the grant application opened, closed on February 24th. The board then went into evaluations, and we extended that evaluation time a little bit without having to change the program year, but it was recognized early on in that process that these were very detailed, very well-established, well-researched applications, and they required a lot of time to read and dig through the details. So that evaluation period went on for over 2 months and led to a board vote on May 5th, in which awards were made contingent upon the execution of the work plans and funding agreements. So that's where we're at right now. We're in process of finalizing those work plans and funding agreements with potentially funded agencies, and contingent upon those being signed and going into place, the program year for each agency will begin June 1st and will go through May 30th of next year, which would then lead into a new program year. There will be quarterly reports required for each funded agency, and so the first report will be due on September 30th, and you can certainly expect that there will be some community updates at that time, giving some of the results of what these programs have accomplished. So the part that everyone's waiting for, if you've not already caught this on the news or watched the board meeting, the board awarded $8.8 million to the, we were able to fund programs in each of those 4 priorities areas, and also able to fund programs for each of those target populations. So that was something to be really excited about, that we received applications for each of the priority areas and for each of the target populations, and felt that we were able to find pretty good coverage of those various areas. You know, again, getting back to that kind of mission of creating an array of services, it was very important to fund programs across all of those priorities and target populations. So fully funded programs equaled a total of $6.2 million. Includes Children's Home and Aid, Winnebago County Doula Program, and also an early prevention and community program, Crusader Community Health, expansion of their behavioral health services, Family Counseling Services of Northern Illinois, expansion of services. Remedies Renewing Life had 2 projects, one for a domestic violence program focused on mental health services and advocacy project, and then a substance abuse focused program, Rockford Sexual Assault Counseling for child focused outreach therapist, Rosecrans Access to Care program, which had 3 components to that. Stepping Stones, Counseling Center, Winnebago County Sheriff's Office, expansion of jail behavioral health services, and then Youth Services Network Youth Trauma Clinic. And then 4 partially funded programs. Please don't infer that because they were partially funded, they weren't as good of applications. In some cases, there were just small components of something that did not fit the strategic plan that was removed from the application, but otherwise were very good and robust applications as well. And for a total of approximately $2.5 million, City of Rockford Mental Health Co-Responder Program, Regional Access and Mobilization Project, also known as RAMP, Independent Living Services and Training, Shelter Care Ministries, Jubilee Member Care Coordination, and University of Illinois College of Medicine Care Program. And so I'm not going to go into detail today about each of those program descriptions because we're still in process of finalizing those contracts with each agency. But looking ahead, once those are executed, you can look forward to a press conference in June in which there'll be a more detailed description of each funded program. And then those program descriptions will also then be added to the Mental Health Board's webpage, along with links to the appropriate organization, so that people can not only read about the program, but then connect to the organization and start making referrals or start utilizing those services that are being expanded in our community. And then in July, we expect to do some more community engagement and presentations to specific networks and organizations throughout the community to raise additional awareness about all of these programs that are being funded. So we'll go into question and answers, but I did want to put this up here for you. If you're looking for additional information, you are welcome to email info@mentalhealth.wincoil.us. You can check out the Mental Health Board's webpage at r1planning.org/WCCMHB. There's a number of resources there, disclosures for different documents, bylaws, and things of that nature. The strategic plan, pretty much everything I've talked about today, you can find on the website. Follow the Facebook page, follow the Instagram page. If you're on social media, you'll get those kind of real-time updated updates from the Mental Health Board, reminders about board meetings, and all of the board meetings are live streamed on YouTube, and you can actually go back and watch past board meetings if you'd like as well to see how the process took place over the past year. And lastly, just if you're not on social media and you want to get updates a different way, you can go to the website and subscribe for email updates, and you'll get those updates directly to your email account. And again, I apologize, it was a lot of information, but give you a minute to digest that, and certainly happy to answer questions.
Yes, well done. Thank you both. Done so much work. So many good things. If anyone does have any questions, just remember, type them in the Q&A box, and I would be happy to facilitate. I'll give you a minute to type. Dick, did you have anything to add while we're waiting for questions?
Yeah, Danielle, Jason, great job. Where we find ourselves in 2021 is this grant cycle is helping us put into place what we had hoped for that was going to come to our community when Singer was closed. So we have had a deficit in the community of and as Jason described, an array of services that we know, those 11 services that fall under the community support program are really evidence-based, that those are the things that are necessary to give maximum help to people to stay in the community and to be part of it. And so that was our goal. We, when Singer closed, a whole group of us, advocates and agencies, had met for over a year to come up with the programs that we had hoped would give us continued support of people. And we lost that through a change in administrations. So this is kind of like the resurrection of a dream that we're going to put into place. The other part that's important, at least in my mind, is the community support program was developed under the National Institute of Mental Health. And it really represented a change in the whole way that agencies that were supposed to work with people who were experiencing mental illness. And that was, you know, I'm old enough and been around long enough that the biggest mistake that we made as helpers early on, we were doing things to people rather than with them. And what the change that took place, that's what took place with the community support program. It was the call to professionals in the field to quit doing things to people, but rather orient yourself to being helpers and stand alongside people and help them, you know, manage their illness. So in addition to that, the other sort of principle that's involved in that, and that is so many times, many of the professionals in the field would find it easier to work with people who were healthy but unhappy, rather than those that were truly suffering from mental illness. The community support program is aimed at helping people who you know are really struggling with serious mental illness or serious emotional disturbance. And so that's really the focus that we want to keep as we go forward with this tax money for providing services within the community. And so that's what we really feel the focus is of the grants that we now have put out. It's staying with those principles and trying to, in a sense, put into place within the community really solid kinds of programs to help people. One of the things that's in that grant, as we went by it, would be a first for this community, and that would be a mobile crisis team, so that we're talking about actually getting to a place where the police, for example, and mental health people would be available to meet people who have mental illness and who are in crisis. So again, we're also then putting the crisis center back in business so that it's there for people 24/7. So these are really, really anchor programs that we want to keep people out of the emergency rooms and keep people out of jail, and rather give them the kinds of services that they need that are truly helpful to them. And that's the dream, and that's the goal that we have.
Thank you. you guys do have some thank yous, some comments that this will really make a positive impact on the community, and it's exactly what our community needs, and that it's very exciting. I do see a couple of questions as well. One of them being, I see more providers as a top need in all priorities. Is there anything to address pay for providers who work for community mental health centers to entice quality providers to work for and stay at those places rather than leaving for much better paying private practice?
Yeah, I think that's a great question. I think that's probably our next biggest challenge, as we've just created dozens of new mental health jobs in the community. So on the one hand, there's the immediate problem of filling those positions and attracting more mental health talent to the area and making those connections with local and regional and maybe even online universities to make it known that Rockford's the place to be. Winnebago County, I should say, is the place to be right now for mental health. But then I think there's the structural part of it as well, that will an agency that may have the opportunity to have a position at a higher pay rate because it's a unique local funding source feel comfortable posting one position that has the same qualification or requirements or certification requirements at one rate, and that same position at another rate when it's billing Medicaid and using Medicaid reimbursement rates. So I think there continues to be the need for state level advocacy for fair reimbursement rates that treat mental health workers with more parity to their physical healthcare counterparts, because I don't think just having local funds will fix that problem, frankly.
For those agencies who receive funding, will they receive an outline or template on how to report deliverables?
Yes.
Yes. If we heard anything clear as we developed this whole thing through our relationships with the county board, that was the critical question, because that has been a complaint against social service agencies in the past. And so we made very sure that, as Jason mentioned, on a quarterly basis, there's going to be reviews. There are markers, and there are evaluative points that we're looking at in terms of expecting outcomes. So this is we really are making every effort that we can to make sure that this public money is spent really well and targeted. So that again is part of the process.
Do you have any consumers on the board?
Yes.
Good questions, guys. Are there any more? If not, please, I'm sure, feel free to reach out to the contact information Jason shared, or to me, and I'd be happy to connect you with the board as well. I do appreciate all the work you two do and have always done. And thank you for being here tonight.
Back
you guys
at you,
and
Danielle.
everyone.
Okay.
Thanks.
Danielle, you do this so well. So thank you for being here and being such a contributor for mental health in this community. So.
Thanks. You guys just make me comfortable, so I feel like I'm
okay.
in a good
That's
spot.
all right. I like to see you turn red. Okay.
Good. All right. Thank you,
Okay.
everybody.
Okay.
Have a good night.
Thanks,
All right.
everyone.
Okay. Good night now.